Alright, here we have another GI focused question for your Step 2 CK. I am Shelf and I am Comat. As always, please like and subscribe, and let's go ahead and jump into it. Before we begin, go ahead and pause the video and answer it yourself. We want you to test yourself before we go through it. That way we can really test your learning. That way you're getting something from it. Now that you've done that, we'll go ahead and jump into it. We're going to jump to the last sentence here. We want to know what pathogen's responsible for his GI infection. Here we have a bunch of pathogens. So now as we go through, we're going to look at the symptoms and see what pathogen lines up with it. A 30-year-old traveler who recently returned from a tropical region presents to the emergency department with complaints of severe diarrhea, abdominal cramps, fever for the last week. He reports having watery stools and mucus and occasional streaks of blood. He also mentions that several members of his traveling group experienced similar symptoms. On exam, he appears dehydrated. His temperature is 101.5. Stool microscopy reveals trophozoites with engulfed red blood cells. What pathogen is responsible? I hope as I read this, there was a big glaring detail in here that kind of screams what the answer is. I'm going to go ahead and highlight what I thought was pretty critical here. And so with that in mind, as you look at the answer choices, I don't know how familiar you are with your micro, but right away we can start to eliminate some because we see that he has blood in his diarrhea and then the trophozoites. Just knowing the blood in the diarrhea eliminates answer A, eliminates answer C as well as E. So really that brings out a 2, and then only one of those 2 is trophozoites. So this is a little bit more of a straightforward question if you're familiar with your micro. I don't know if you've seen what an Anamoeba histolytica, the correct answer B, looks like, because they can also show you that on exams. Here's a little picture, Anamoeba histolytica, and comparing it with Giardia, because both of them, as you can see here, are trophozoites, both Giardia and Anamoeba histolytica. The difference between the two was the bloody diarrhea, because Giardia normally does not have bloody diarrhea, it's just the watery kind, but the trophozoites with engulfed red blood cells, that's code for Anamoeba histolytica. And in the question, they could have given, someone who is immunocompromised, HIV, all of that fun jazz that they sometimes give, but this question was pretty straightforward with it being Anamoeba histolytica. And just go over when you might see some of the other questions. Giardia, as we mentioned, is more of a watery, foul-smelling stool without blood or mucus, so that you're looking for that. Option C, Cryptosporidium parvum. It's another protozoan pathogen that can cause diarrhea, but it's usually in the immunocompromised individual, so they would say they have HIV or something along that. And it doesn't really lead to bloody stools either, as I mentioned before. Salmonella, option D. It's a bacterial pathogen associated with food poisoning that can cause diarrhea, and it usually presents with more acute symptoms and less chronicity, as we see here. Because as we saw, it's a fever for the past week, so it's been going on for a little while. It's where salmonella is more acute. And then option D, they would always give you some question stem about someone who just recently had surgery or was on antibiotic or something of that cause. And here we have no antibiotics, so we know it's not option D. There you have it. As always, please like and subscribe and comment what kind of questions you want to see in the future, what topics you want us to cover, and that's it.